Chief Executive of Lincolnshire Partnership Foundation Trust, the NHS Trust responsible for mental health and learning disability services across the county. Welcome, John. Thank you very much for joining us.
Thanks for inviting me. Hello.
Talking of services in particular, Jessie Robson-Galvin asked why the county's dynamic psychotherapy services are being closed down. Worryingly, this hasn't been publicised from our knowledge by the Trust. Has the service already been closed down, and was there a consultation?
Okay, the service is being run down to, I think, finish with the people it's currently seeing by the end of this calendar year. Okay. The decision to stop commissioning that service was made by the clinical commissioning group. Again, it would be something that I would like our trust to be able to provide. From the quite generic that deal with a high volume of people with relatively common mental health conditions that we provide very well, and a lot of people recover. We've got some of the best recovery rates in the country. Due to increasingly specialised services, you'll have heard of CBT, cognitive behavioural therapy, and then at the other end of the spectrum there are services like dynamic psychotherapy that are much more specialist, see a smaller volume of people, and there is perspective that they're not viable in the current financial
Sure, but some would argue they are still just as important, and people will rely on them just as much as they do other services. You say it's a CCG sort of decision, but there must be some sort of communication and compromise between yourselves and the CCG.
Yes, so we're working with both the people that are receiving that intervention with the staff group there and with the CCG about enabling them to finish the treatment that they're on and enabling that there are sufficient alternatives available for those people. So one of the things about psychological interventions is that there isn't necessarily only one type that a person will be able to benefit from. So quite rightly, dynamic psychotherapy won't be available, but there will be a number of other psychological interventions that I'm sure would be able to help that person make progress. And there are obviously discussions within the county. I was talking to you previously about something called the Sustainability and Transformation Plan, the STP, which is a national programme that's all trusts and primary care are involved, how we can make services better for people in terms of keeping people out of hospital if they don't need to go, providing a range of treatments as close to home as possible. We know we haven't got that right. Services that are going to significantly change, we'll have a public consultation on. There are some things within that we are working up to make sure that we've got our plans clear before we consult. You may be aware that our learning disability inpatient unit at Longleys Court in Lincoln has been temporarily closed for some time, and we will be going to public consultation to make that a permanent closure. But obviously we want to garner people's views on that. We believe that in the 18 months or so since it's been temporarily closed, we've been able to provide a much better quality service for people in their localities and home, and the number of people requiring admission has been massively reduced, and that can only be for the better.
So what lessons have been learned from the Longleys Court investigation so far?
There's still a number of quite sensitive issues that I'm not able to discuss, but I think for me one of the real learnings was, as I've just described, really you get to the habit of this is the service that we've always provided and it's good, it's okay, and staff do a good job, and we might not necessarily think about what other potential models of service may be actually better for people. And this came through quite an urgent review of that service, but actually the result, I think, in the long term will be better for people.
Well, a few people got in touch on the subject of waiting times. Zachary Kellerman asked, why are people waiting years to get psychological therapy, and what are you doing to specifically improve waiting times?
Yeah, that's a really pertinent and good question. It's a good challenge for me and my trust to get this resolved. It's been an issue for some time. There is a massive demand for psychological interventions, but we haven't got our if I could use the jargon, the service offer, the service that we provide right yet. Two things that we've specifically done. In recent months, we've recruited additional staff in the psychology department to start to resolve that long waiting list issue, because it's right, it's not right that people have to wait so long for it. And we've also recently gone out to some independent providers of psychological therapies to see if they will be available to provide some additional interventions for us to purchase so that we can ensure that people don't wait and we can get the waiting list down.
And how many patients have you currently got on the waiting list for treatment, and what is your average sort of waiting time at the minute?
Yeah, I couldn't quote that off the top of my head. The majority of people don't wait too long. I can't say exactly what it is, but we know we've got what we call historical wait, where I think there are 700-800 people that have had to wait for 2 years.
Yes.
And I agree, that's too long, and we aim to resolve that over the next 6 to 9 months.
I'll just put a comment to you from Anthea Gamble, who came to us with her personal experience as well. She said that she faced a 2-year wait, and that her referral was actually lost 3 years ago. She said that her and her family have felt let down. What do you have to say to her?
I'll apologise. I'm sorry that that's been her experience, and I'm sorry that she feels let down, and we need to get better at making sure those incidents and events don't happen.